ancient Egypt is renowned for its pyramids, the enigmatic mysteries of an old civilization, and curiously enough, eye problems. Imagine life surrounded by swarms or tiny insects constantly trying to invade your eyes. Or winds that bring sandstorms funneling grit into your eyes, with no Ray-Bans in sight for another 2,500 years. Not exactly perfect. Indeed, the Egyptians grappled with eye infections and irritation. It's not a surprise that these problems were among the predominant health issues for the average Egyptian millennia ago. It's no wonder then that Egypt was the birthplace of the world's first recorded eye surgeries. Doctors specializing in ophthalmology were regarded as the elite, living lives of neo-pharaonic luxury. Curious about how the ancient Egyptians managed eye care, I delved into their methods. Frankly, some of their techniques are enough to make your hair stand on end in places you didn't know had hair. Here's just the taste of some of their least alarming practices. So the first one is turtle brain and honey. An ancient medical papyrus urges grinding up turtle brain with honey and then pouring the mixture directly into the eyes, all while reciting a special spell. Interestingly, spells played a crucial role in ancient Egyptian medical practices, often considered more important than the remedies themselves. The entire process must have been quite a spectacle. The second is the pig's eyes with honey and ochre. A rather intriguing remedy from another ancient Egyptian text prescribes a blend of pig's eyes, honey, and ochre. This mixture was to be poured into the eyes, or rather alarmingly into the ears, to grant the patient instant vision. I imagine the patient, after experiencing the first round of medication, would quickly claim they could see clearly just to avoid a second treatment. Subsequently, they might navigate home blindly, losing all the illusions about the medicine. The third method is bad blood. Another unique cure for blindness and eye infection was bad blood. It was administered orally to the patient and also dropped into the eyes because, of course, why not? Naturally, after such treatment, the patient would scream that they could see for miles around, if only to prevent a follow-up session. The fourth option is pig liver with honey, and back to the pigs we go. It wasn't enough to harvest their eyes, now their liver was mashed up with honey and introduced into the patient's eyes or ears, which seemingly didn't make much a difference. Personally, I believe rubbing this mixture into one's heel would have been just as effective. This method was primarily used for treating children who, after the procedure, were expected to eat the remnants of the pig liver. Whether it was cooked first is a detail lost to history. Considering all of the above, I have my doubts it was cooked or even cleaned. These are only a few examples. Egyptian medical documents contain a plethora of such treatments, many of which wouldn't pass YouTube's content guidelines, so I'd rather not detail them here. One might wonder if any of these methods actually worked. After all, they were tested on thousands of unfortunate patients. Had there been no effect, it's unlikely they would have been documented in medical texts. There seems to be a pattern. These ugly mixtures were often made with honey, a natural antiseptic, which likely helped soothe inflammation and pain if poured into the eyes, rather than the ears, of course. Liver, too, is mentioned often, and it's rich in vitamin A and other components essential for healthy vision. Presumably, if children were subjected to these frightful mixtures of pig liver and honey, over time, it might have yielded some results. While the ancient Egyptians are considered pioneers in many medical fields and achieved significant progress in treating a variety of health problems, it would be a stretch to label them proficient ophthalmologists. Nevertheless, when one looks at the bill from the modern doctor, the willingness to try a turtle brain or pig's eyes might just surge. But that's more a critique of contemporary medicine and its shortcomings.